Welcome back to the Pain Sucks podcast. I'm Dr. Matt.
Dr. Justin.
It's awesome to have you here. We really appreciate those of you that have been listening and sharing. I know a lot of people have been downloading the episodes and either listening to them or watching them on YouTube, which is an option as well. So today we just want to stick to another joint.
Right.
We're going to talk about another joint. Last week was knee. We're going to talk about the other one that everyone's coming in with right now, and that's the shoulder. Particularly, we're going to talk about the rotator cuff.
Oh yeah,
not the rotator cuff.
That one rotator cuff that we have.
The one rotator cuff. It's actually called
a rotator cuff.
Rotator cuff, C-U-F-F. Let's get that myth out of the way right now. So, Dr. Justin, talk to us about the rotator cuff.
So the biggest misconception we get all the time is they come in and they assume it's one structure, like a bone. Like I tore the rotator cuff.
Right.
Like that, done. Your rotator cuff is actually 4 small muscles, okay, like that. So it is not one singular structure. It is 4 very tiny muscles in the shoulder that are designed to stabilize the shoulder. They really don't even move the shoulder, okay? So it's this big misconception that like my rotator cuff doesn't work, I can't do this. Nothing to do with that. So those 4 muscles attach on top of them, okay, and they roll that joint back and forth, but the minute your brain triggers...
When you talk about that joint, you talk about the shoulder joint, shoulder joint, okay.
Because in theory, like that joint is so unstable. Okay, you're talking in comparison sizes, you're talking about a golf ball sitting on a tee, okay, to the shoulder actually attaching to the rest of your body. So there's not a big bone, it's not like a knee, bone on bone like that. So it's a very, very unstable joint, so it needs all the stabilization that it can get. Okay?
Yes.
So the rotator cuff, whenever your brain tells it to fire, those 4 muscles grab a hold really tight, and it allows that joint to make really smooth movements.
Right.
Okay? So when that rotator cuff is injured, one of those 4 muscles, okay, it could be any of the 4, okay, you get this lag effect where there's no longer the smooth movement and it's like clunking into stuff the entire time.
And what are some symptoms that people will feel when the rotator cuff becomes a problem?
Well, there's 2 ways to injure it. One is just that really acute injury. Like I was running through the yard and I fell and landed on my arm, okay,
right.
And it hurts like that. You have a rotator cuff injury problem,
right.
Okay. The most common, those are easy. Okay, the most common one that we see is that degenerative tearing. Okay, it's been going on for 5 years or 10 years or 20 years even, and it just never got fixed properly. Okay, so they come in and there's pain,
right.
Pain on any movement. Usually pain at night, they can't sleep on it.
Right.
Weakness,
right.
Loss of grip strength.
Right.
Like that, they're noticing it when they're getting dressed. They're like, I can't reach behind me.
Right.
Women, all the time, like we hear this statement all the time. They go, when I put my bra on,
yeah.
Like, I cannot reach behind my back at all. I cannot
right.
put my arm behind
right.
my back.
Yeah.
Okay. Those type of symptoms that just get worse over time.
Yeah, so if you're thinking this is you, one of the things we see is like right here in the front, people will go, ooh, right in there,
Yep.
There's like a little groove and they'll say it
You
hurts
can touch
there.
it.
Or like over on the side here, they'll hurt there. And what's funny is like neither of these are really rotator cuff, but they're now exhausted from your rotator cuff not working correctly, and so you're feeling that. You will have people have knots up and down the shoulder here, and one of the things that we found is that really with this degenerative state, you've asked your rotator cuff to do the job that other big muscles are supposed to do. Like, here's what I always do. If you watch a professional pitcher in the major leagues, they throw with their butt and they throw with their upper back. They do not throw with their shoulder. The rotator cuff stabilizes their shoulder, and the big movers throw the baseball. Same with quarterbacks.
Right.
With these moves. But that's not us. But what we are doing is perhaps playing catch in the backyard, and we're not using big movers because we're out of shape and our core is terrible, and we haven't exercised in forever. Or how about the people just reaching for a cup or reaching for something out of the cabinet using the wrong muscles? Holding kids. Picking things up off the floor. And it's this over and over usage that leads to, ow, it hurts here, I can't move it, it doesn't do right, and it's the rotator cuff that's the problem. So, what do we do about it?
Well, and I'm going to add to this. On top of this, well, I'll get into that in a minute.
Okay.
What's causing it? Okay. First thing is that you've got to identify where the problem is. Okay. Because there's other shoulder issues. There's labrums, and they kind of go together and all that. We can do it really in depth on this.
Right.
But if it's a very minor injury, we can just rehab it. Okay,
Right.
we can just give exercises and do that, and it kind of goes away.
Yeah.
Okay? But I'm going to tell you now, like that, generally there's a partial tearing in there. Okay, we can rehab that similar to the knee. Then you jump into that regenerative med world. Okay, we can do platelet-rich plasma. So if you don't know what we're talking about, go back and watch the knee video. Okay,
Yeah.
we went into detail on
Yeah.
platelet-rich plasma, how it works. We've done one on stem cells. So if it's completely torn, we can do stem cells on it. Or look, there's surgical options there.
Right.
Like that is one of the things where we get an MRI sometimes and go,
You need it.
yeah, you need surgery. Like unfortunately.
Beat on it.
However, most of what we see when they come in and they go, it's chronic, it's been bothering me 5 years, 10 years, something like that. The root cause. Okay, let's get to the root cause of
Root
this.
cause, all the way upstream.
Is they can't stabilize that shoulder.
Correct.
They have their scapula, their shoulder blade can't swing properly.
It's not
They
moving.
can't engage it, and that is a neck problem.
Yep.
They have a cervical spine problem. Their neck is forward here. Okay.
Yeah.
Simply, guys, do this at home.
Yeah.
Lay your head all the way back and raise your arms up over your head like this. And then I want you to take your head and I want you to look at the floor and try to get your arms up in the air.
Yeah.
Okay. And they lock there. Like it is physically impossible to be able to break your arms past that. Okay. So they come in and they're like, I can't move and it hurts and all this stuff. They have a neck issue.
It's the lower and middle parts
Yes.
of your neck where the spine is not moving, compressing the nerves, and your body's gone into this whole thing. We're in protection mode. You roll your shoulders forward, your head sticks forward, and that's how people get old in this country.
Yes.
They get old growing forward like this. We can't use our shoulders, and over time, that degeneration begins to set in. I've heard people talk about rotator cuff and use the words like frozen shoulder.
Right.
Have you heard of that before?
Absolutely.
Yeah,
Absolutely.
Are they similar?
If it's frozen shoulder can be the end game of a rotator cuff. If we leave it alone
Yeah.
and it scars over and scar tissue and scar tissue and scar, eventually that thing will adhese together.
Yeah.
Okay? So all of those ligaments that are rolling over each other that should be smooth, they're going to adhese together, they're stuck, and then it's done. Like that, they literally can't move it.
So for folks who are like, I just stuck my head forward,
Yep.
you're right. And then the other ones who are like, I can't move it. And the
Yep.
other ones looking at their posture right now and going, this is exactly me. What percentage of people could get to a chiropractor, get a proper set of x-rays, go through a proper treatment plan on their neck and their shoulders, just do some basic rehab and get better?
If it wasn't completely torn
Yeah.
and it was fixable,
Yeah,
85-90%.
agree.
It's
Most
a
would
high
have
number.
great results,
it is
right?
such a high number.
Right.
And how many of you guys are sitting at home, because we see this all the time, where they come in and they go, I had this problem years ago. I went in and look, they got good care. They got the right care. Like that, they got a cortisone shot from the doctor. They went and did rehab on it. It was great for like 6 months.
Yeah.
And then it just came back.
Right.
Okay. And it's because none of the problems that caused it were ever fixed. Like
Right.
none of the actual cause, but they got rid of symptoms.
Right.
And they strengthened it. The shoulder's strong or
Right.
was strong.
Right.
But it never fixed what was actually causing it in
Right.
the first place when the cause was so simple.
Right. So the majority of people listening to this, listen, you need to get your butt to a chiropractor
Yeah.
and get some neck x-rays and maybe some upper back x-rays. And you need to get motion, life, movement,
100%.
balance,
Yep.
and rehab done through all the areas of your upper half of your body,
Yeah,
essentially, and you'll be okay. But there is 20% of you that you've been living it through for a while. You know you can't turn the screwdriver anymore when you do
Exactly.
stuff. You know that trying to lift your arm up to get that cup out of the cupboard, you can't do that anymore. And the truth is the doctor's already taken an x-ray and said you've got arthritis
Right.
and degeneration. Now what?
Oh, now. Okay. Once again, that's one of the things that we do is when patients have already, we love MRIs of shoulders.
Yeah.
Love them. Like that. They show all the damage and where it's at and how bad. Because then you're going through options. Okay. Then you're going, we can do low level, we can do rehab on it, we can adjust, we can work on neck, mobilize it, some string training, you're great. Okay. Moderate problem. Okay, we're going now. We can do those things, but you're going to need some help healing. We're going to need some kind of that regenerative med. We're going to need a PRP injection or two like that to get it back healing. Okay, on the high end, lots of damage, and we've gotten some phenomenal results for shoulders. Okay,
Yeah.
they just respond so well when you
Yeah.
do them correctly.
Right.
Okay, but it's not, once again, same with the knee. You're not allowed to piece it together.
Right.
You can't just get a shot, never do anything else.
Right.
Like you have to do the package.
Right.
Okay, or the plan that's laid out. Most of it can be done at home.
Yeah.
Okay, but then you're talking stem cells in that shoulder, regrow damaged tissue, like re-strengthen that so you get a permanent fix to it.
Gotcha. So at the basic level, your really local chiropractor could do a great job for you,
Yes.
maybe even mixed with your local physical therapist, but they need to be done together,
Right.
because adjustments are mandatory.
Yep.
And then the next level would be getting into some heavier end rehab and things like the shockwave machine that we
Yes.
have and some PRP, and
Phenomenal.
all the way up to where we're just rebuilding that shoulder and hopefully preventing
Correct.
surgery. One of the things I want to add is that most people listening to this that don't really remember a shoulder injury, likely if you're feeling it now, there's probably several decades worth of stuff that's been happening that now you're starting to feel. So we want to encourage you to go back and listen to the episode we did on chronic inflammation and
Right.
pain, because there's a lot of great helpful resources that you can do at home while your body's learning to heal through the things we talked about today.
Correct.
We're also going to encourage you that with the shoulder, we always tell people you're just going to have to be patient with this and let it heal. There's four little
Simon.
muscles, but they're little enough that they've been doing the work of the big muscles and tendons and ligaments and things that have
Right.
just got beat up. They need time.
And it's such an unstable joint.
Yeah.
When you lose stability in that joint and the other muscles are having to compensate
Right.
the entire time, there's a lot, just like in the knee where we talked about, it's not that it was weak. We have to relearn how to use it and retrain it. We have to do the same thing with those muscles,
Right.
and that takes time to be able to heal.
Good.
This is not an overnight process.
So be patient, but what we do know based off of between the two of us, well over 40 years of practice. If we had Jesse in there, we're at 60 something
Right.
years of practice. We know that if you do it right and you cover the foundation and add as needed based off you will be successful
Yes.
with time and doing things
Yes.
correctly. Body knows how to heal. So we want to encourage you. It's not too late.
Yeah.
It's not too late. Have someone take a look, come and see us. Remember, and last thing I'll leave them with, it's called rotator cuff.
Not a cup. It's not a cup.
And yet you
It's
have
not one
two of
cup.
them, and they are super important
Yes.
for you to keep healthy.
100%.
So guys, we want to thank you for being here. Listen to the other ones, like and subscribe. We're going to keep throwing these things out weekly, and I know people have been blessed. So remember, nobody, and we mean nobody, gets to tell you that you can't heal. I'm Dr. Matt.
Dr. Justin, guys.
Be blessed. Have a great day.
Amen.